Hi, this is Lindsay Doctor demonstrating a video about communication strategies through role play with the assistance of my husband, Chris.
Come in.
Hi, my name is Lindsay. I'm going to be your student nurse today.
Student, how long have you been in school? Do you know what you're doing?
Yes, this is my second semester in clinical, and I'm also working along with your regular nurse. Do you have any concerns about having a student?
No, you're all confident anyway. I just got moved out of my ICU and I've been in this hall all night.
I'm sorry to hear that. Sometimes because you were more stable, a more unstable patient needed the bed in the ICU, but at least we've got you moved into a regular room now, and hopefully we can take good care of you today.
I still haven't seen my urologist yet since I've been in the hospital. How much longer till I can leave?
Well, I don't think you're going to be going home today, unfortunately. You've been scheduled for another CT scan, and you also need your urine and blood cultured. Your last CT scan showed that you had pyelonephritis and hydronephrosis still.
What's hydronephrosis?
It's the swelling of your kidney due to the backflow of urine. It's why you had the stent placed in your kidney 2 weeks ago.
Are my kidneys still even functioning?
Well, your doctor is monitoring your kidney function through labs and tests, and so far it appears that your labs are still normal, but I encourage you to discuss it further with him when you see him.
You said that I had to have my urine and blood cultured?
Yes, because your pyelonephritis is not resolving. The doctor wants to make the antibiotics that you're receiving more targeted to the specific organism that's causing your infection.
How do they know it's not improving?
Well, you still have white blood cells in your urine, you still have blood and bacteria in your urine, and you're still spiking fevers. Well, additionally, the doctor has ordered that you receive 2 units of blood because your labs are showing that your hemoglobin is low.
Why do I need blood? What's low?
Your hemoglobin is a part of your red blood cells that carry oxygen to your tissues, so when it's low, your organs don't get an adequate oxygen supply.
I feel fine, I'm just a little tired though.
That's consistent with having low hemoglobin, and it also appears that you're a little pale, which is also consistent with the lab findings.
Is it safe? How many times have you done this?
My nurse is going to be with me during the procedure, and there are a lot of checks now. The blood is tested for infectious diseases, including HIV and hepatitis. Do you have any other concerns about the blood?
What's the chance that I'll get a disease like AIDS or hepatitis?
Well, as I said, the blood is tested for those diseases. Additionally, the lab is going to draw a sample of your blood so that you won't have an allergic reaction or a hypersensitivity reaction, because they're going to match your blood to the donor blood, and we will be with you during the first 15 to 30 minutes that it's being infused to make sure that you're not having a reaction to the blood.
Now let's do it. It doesn't seem like they know what's wrong with me. I have to keep coming back to have stuff done or come back to the hospital and have stuff done.
It sounds like you're really scared because of all the frequent hospitalizations. I'm also sensing that you really aren't being involved in your medical care. Do you feel that's true?
Yeah, I don't think they know what's going on. I keep having tests, but nothing ever seems to come of it.
Have you shared these concerns with your doctors?
No. Every time I see him, I forget what I want to ask him.
Why don't we make a list of questions so that the next time you see him, you're more prepared and you have an idea of what you want to ask him and you don't forget anything.
That would be great. Thank you.
Okay. In summary, in this interaction, the nurse could have used less medical terminology, which may have put the patient more at ease and made him feel more involved in his own care instead of having to go back and explain everything to him and making him feel anxious about all the use of medical terms that he didn't understand. Good interactions were that the nurse used a lot of therapeutic communication strategies. She didn't give him false reassurance. She used open-ended statements such as, tell me about your concerns. She used touch and reassurance. She also used clarification to make sure that the message being sent by the patient was the same that was being sent by the nurse. And that concludes this video.